Alrighty, so today we'll be doing a head-to-toe assessment on a patient. Before I do go in, I will go ahead and check their chart, see what's going on. It looks like this is a 67-year-old male who presents to the ER with severe right upper quadrant pain in the abdomen. He complains of nausea, vomiting. He's got a fever of 101.5. And whenever I enter the patient's room, I will verify every single one of these things to make sure that, where the pain is, the fever, any other associated factors that may be going on as well. So go ahead and enter the patient's room. Hello, my name is Catherine. I'll be your nurse today. How are you doing?
Not so good.
Okay. What brings you in today?
Abdominal pain on my right side.
Alrighty. If you can tell me your name and date of birth.
Ernest Howard, November 14th, 1955.
Alrighty. Do you know the current president?
Joe Biden.
Okay. So you said your pain is in the right upper area of your stomach.
Mm-hmm.
Any other symptoms that you've had? Any like nausea?
Yeah.
Any other symptoms?
Mm-hmm.
What else?
That's it.
Okay. Any vomiting?
Mm-hmm.
Any bloating? Anything like that?
That's it. Mm-hmm.
Just the nausea, vomiting?
Yes.
Okay. Can you rate your pain from 0 to 10? 0 being the least, 10 being the most.
Up 10.
Okay. Have you taken anything to help you?
Some ibuprofen.
Ibuprofen. Anything else?
Tylenol.
Tylenol. Okay. Anything else?
That's it.
Alrighty. Are you having normal bowel movements?
Mm-hmm.
Going regularly?
Mm-hmm.
How about the color?
Normal.
Okay.
Nice and brown.
Okay. Any diarrhea or constipation?
No.
Okay. How about when you urinate? Are you having trouble urinating?
Mm-hmm.
Okay. How about the color?
Yellow.
Okay. Any odor or anything like that?
A little bit.
Okay. Any discomfort?
No.
Okay. Alrighty. How long has the pain been going on?
A couple of days.
Okay. And do you notice anything that causes the pain more?
No.
Is it like, have you noticed like it's before you exercise or before you eat or when you walk or stand up?
When I'm standing.
When you're standing? Okay. How long does the pain last when you're standing or?
A few minutes.
A few minutes. And you said it's been going on for a couple of days. Alrighty. So we'll go ahead and we're going to do a head-to-toe assessment. So we'll assess the rest of your abdomen and everything else, and we'll do, again, a head-to-toe assessment. So the patient is alert and oriented to time, person, and place. He is dressed appropriately. He's sitting comfortably. He is, again, dressed appropriately to the weather. Just by assessing, I don't see any signs of like use of accessory muscles or any problems breathing. He's in a relaxed position. Just assessing his arms, I don't see any signs of abnormalities, any lesions, wounds, or discoloration. Hair is evenly distributed in extremities. And of course, I would also put gloves on, and I would check for edema. No signs of edema in hands or arms. No signs of edema in the legs. Alrighty, so I'll go ahead and get you to stand up. We're going to assess the gait. So I'll let you walk that way and come back this way. Alrighty, so gait is coordinated, smooth, rhythmic, and then you'll do your heel toe. You'll go that way, heel toe. Alright, patient is able to do the heel toe. No signs of imbalances. He's able to maintain his balance. And then you'll do your heel up your shin. Alrighty, and the other side. Alrighty, so the patient is able to do his heel up to his shin, and it's smooth, coordinated. He doesn't have any trouble doing that. Alrighty, so I'll let you go ahead and just kind of rotate your ankles for me. And do the other. Alrighty, and flex and point your feet, both. Okay. And the other. Okay. And open up your toes and crunch them, close them up. Okay, and then close them. Okay. Alright, and then we'll go ahead and do your hips. So go ahead and kind of rotate your hips. Alright. Alright. So, and then we'll go ahead and I'll let you go ahead and kind of go forward. Okay. So we'll go ahead and assess the patient's spine. There are no signs of lordosis, kyphosis, or scoliosis. Do you have any tenderness?
Mm-hmm.
Okay, no signs of tenderness or crepitus. Alrighty, and we'll go ahead and assess the warmth and also around the lungs and the scapula. Scapular symmetrical. They're not protruding or anything. No signs of crepitus in the lung area. He is warm. Alrighty, so I'll let you go ahead and stand back up for me. Alright, and you'll do your arms, just kind of rotate both arms. Okay, so he's able to rotate his shoulders, you can relax. And then do your arms behind your back, okay, and then above your head. Alrighty, and behind your head. Alright, so the patient's got full range of motion of his shoulders, his elbows, his hips, his spine. Alrighty, you can go ahead and relax your arms. Alrighty, and then you're gonna bring your arms to the side, you're gonna flex them and also, okay, and do to the outside. Alright, rotate your wrist and do each finger to your thumb. Alrighty, and I'll go ahead and assess the patient's hands. Make sure that there are no signs of clubbing or anything like that. Cap refill is 2+. And I'm going to go ahead and assess. He's got a minor scrape right to his right arm. What happened there?
I dropped something on my arm.
Okay. And it looks like the little lesion is, it is red, but it is healing properly. No other signs of lesions or anything like that or wounds. And then we'll go ahead and do pulses. All right, 2+. Radial 2+. Brachioradial 2+. They're equal bilaterally. Cap refill. Also, alrighty. Okay, so I'll go ahead and let you sit at the edge of the bed. Okay, so we'll go ahead and assess the reflexes. So you'll kind of put your arm this way. Okay, so the reflex. All right, that's 2+. All right, and we'll do your other side. And I'll hit it. All right, 2+. And then we'll do your popliteal. And this is like kind of where your legs kind of kick. Okay, 2+. Alrighty, we'll do the Achilles. 2+, 2+. Alrighty, and I'll go ahead and assess the popliteal pulses. 2+. Alrighty, 2+. We'll do your salus pedis. That's 2+ equal bilaterally. Okay, and then we'll go ahead and I'm gonna remove your socks. And we're gonna look at the cap refill as well. Cap refill, 2+ equal bilaterally. Alrighty, so I'll let you go ahead and lay back for me. Okay, sit up a little bit more. Alrighty, so we'll go ahead and we'll also do vital signs. So we would do the patient's blood pressure. We would do respirations, we would do pulses, apical pulse, temperature. So we would do the temperature, and we would be orally, so I would check it under the tongue. It was 101.5. Also on his chart, it says that he has a past medical history of hypertension, obesity, and alcohol abuse. So he did have those in his chart. And we'll go ahead and continue to assess the patient. Blood pressure was 128 over 80. So it was within that normal rate. That blood pressure. Pulse was also 70. When I checked his radial pulse. Respirations, again, he's no use of accessory muscles, or difficulty breathing. Respiratory rate is about 16, so it is within that normal range. So we would do the pen light. So I would do the pen light and I would assess. I'm going to just put my hand right here. Alrighty, and I will check the other one. Alrighty, so pupils are equal, round, reactive to light, and accommodation. Alrighty, so I'm going to, so this will be this is dull, this is sharp, and you'll describe it dull and sharp. I'll also do it on your face. We would do dull and sharp, and you'll describe it. So I'm going to get you to close your eyes for me.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Alrighty, so the patient is able to verify the sensations of the dull and sharp. Alright, so I'll get you to close your eyes. Let me see your hand. Palm up. Okay. I'm going to put an object and you tell me what it is.
Paper glove.
Alright, so patient is able to describe and identify the correct object. So, and then I'm going to write a number on your hand and you tell me what it is.
4.
Okay.
3.
Okay. The patient is able to identify the numbers correctly. You can open your eyes. Alright, so I'll go ahead and listen to lung sounds. So I'll just kind of get you to sit up. Well, actually, we're going to do your abdomen first. Alrighty. Alright, so abdominal sounds are equal bilaterally, about 5 to 30 clicks per minute, which is within that normal range. No signs of distension, and just for video purposes, I wouldn't lift the shirt, but we would lift the shirt, make sure that there's no lesions. There are no signs of lesions. The abdomen is rounded, no signs of distension or any type of discolorations or anything like that. So I'm going to go ahead and palpate. You tell me where it's tender.
Right there.
Okay, so that does verify that the patient has that right upper quadrant pain. Alrighty. And then other 3 quadrants are non-tender. Alrighty, so I'll let you go ahead and we're going to listen to your heart. And then I also saw that the umbilicus was midline. Alright, so apical is about 70. And no signs of any murmurs. So S1 and S2 were noted. Alrighty. And then I would check the aortic, which is normal, no bounding or anything like that. Alrighty. And then the patient, he does speak English. He's able to communicate properly. So we're gonna listen to your lung sounds. So I'll kind of get you to sit up in a second, okay? Take a deep breath. Okay, and out. Deep breath and out. Breath and out. Deep breath and out. Breath and out. Deep breath and out. Alrighty, I'll let you kind of sit up a little bit. Deep breath and out. Breath and out. Breath and out. Deep breath and out. Breath and out. Alrighty, so lung sounds were clear, equal bilaterally, both posteriorly and anteriorly. And then I would continue to assess my patient. And then I'll go ahead and assess your bladder. So, any tenderness in your bladder? Okay, so no signs of tenderness, no bulging or any masses or anything like that. And I would continue to assess the patient. And then last thing, we're gonna do your eyesight, your vision. So if you'll stand up for me, we're gonna do the Snellen test. Okay, so I'll just get you to, Snellen is over there. So patient would stand about 20 feet. And then you'll cover one eye, tell me what it is, cover the other, tell me what it is. So the patient's vision is 20/20. And then we'll do this. So you'll cover one eye, cover the same, okay? Tell me when you see it.
I see it.
Okay.
I see it.
Okay.
I see it.
This way.
Mm-hmm. I see it.
All right, other side.
I see it. I see it. I see it. I see it.
Okay. All right, so take your little paper off. Now you're gonna follow my hand. All right, so the patient is able to follow my hand correctly. His peripheral vision is normal, no signs of abnormalities. Alrighty, you can go ahead and sit down. And then we'll do the jugular vein. So I'm gonna check carotid. No distension or bulging in the jugular vein. And then I would listen to the carotid with the bell. No bruise. No signs of bruise. And then hold your breath. Okay, no signs of bruise. Alrighty. And then we would do olfactory, so just say, okay, so close your eyes. Close your eyes for me. Alrighty, and tell me what you smell.
Candle.
Okay. Alrighty. And then open your mouth. Alright. Uvula is symmetric. Get your tongue in. Just open your mouth. Alright, uvula. Okay. No signs of hoarseness or anything like that. Alright, and then you'll do your open your mouth, your jaw, left to right, up and down. Okay? Alright. Now, close your eyes, open your eyes. Yep. Alrighty. And then frown. Okay. Alrighty. So, the patient's reflexes, they are normal. Cranial nerves are all within that normal range. No signs of paralysis or anything like that, or any difficulty with any of his cranial nerves. I will continue to assess the patient. And this concludes my head to toe assessment.